Hi everyone. Today, our group Team 2 will be discussing our case study on Alan and Anthony. Alan, a 44-year-old single mother living on Ontario Works, has a 5-year-old son named Anthony, whose teacher is concerning that he is exhibiting signs of spectrum disorders. Now, let's take a look at the case study. Alan, a Black lady residing in the Black Creek community, struggled a lot in her life. She started taking drugs at her early age and left her school too. She got a job at a local pub named Fisherman Lodge Pub. At the age of 30 years, she got married to a man named Matt, but she experienced with physical violence after this. She got fired from her job after showing a disrespectful behavior towards her coworkers. She filed for divorce but was pregnant at the age of 39 years. Earlier to that, she experienced one miscarriage too. She gave birth to a baby boy and named as Anthony, who was underage at the time of birth. She tried to manage her finances through Ontario Works and managed to provide care to her child. She managed to send Anthony to a local school named Kids Kingdom Nursery School. The time when Anthony reached his 4 years, her preschool teacher Anna observed some unusual behavior showed by him. She noticed that Anthony never responds back when his name has been called. He always plays alone, not interested in interacting others and making friends. He found repeating words and phrases. Anna feels Anthony is exhibiting signs of autism spectrum disorder. She wants to help him, but she doesn't know how she can help him. Anna reached out to Alan and told her about Anthony's behavior, but Alan replied that she has to face some financial stress associated with the therapies. She has to devote more time towards her baby and must have to adapt as per the child. Moreover, she has to face difficulty in finding specific resources, surviving criticism from the society, and even total strangers who assume that the child with autism spectrum disorder is out of control, which is challenging. So the next part will be covered by Carla.
Okay. So Alan will now take Anthony to his appointment at the Black Creek Community Health Center. Here they will meet first with the nurse and then see the nurse practitioner after. We are going to discuss how the nurse will develop a care plan for Anthony and Alan. Okay, so plan of care. We're just going to start by looking at an overview of how the social determinants of health may affect this family. So for income and income distribution, Alan is on Ontario Works, which means she has an income of approximately $733 a month, plus possibly some child subsidies. 29.4% of females in the Black Creek community rely on government subsidies as their main source of income. For education, Alan did not graduate high school and has no post-secondary education. Anthony is in kindergarten at Kids Kingdom Nursery School. For unemployment and job security, Alan is unemployed and has been for 2 years. For early childhood development, Anthony was born with a low birth rate and is otherwise healthy. And his preschool teacher, Anna, has noticed some signs that exhibit possible autism spectrum disorder. For food insecurity, Alan is on a fixed income. With rent and bills, she can only afford $100 a month for groceries. Because she cannot afford a lot, she often results often to cheap processed foods. And then for housing, Alan lives in a one-bedroom apartment in Black Creek, Toronto. Average rent for Black Creek is about $1,011 per month, and that's for a one-bedroom apartment. Okay, and then for social exclusion, Alan is separated and has no close family or support nearby. Her social safety network is that she does not have a lot of support in her community. She does have some neighbors, though, who she considers her friends. Health services, Alan and Anthony have a primary care provider at the Community Health Center in Black Creek. Alan cannot afford out-of-pocket healthcare services, so ongoing therapy for her son if needed. For gender, Alan is female and Anthony is male. Females in the Black Creek area are more likely to be on government assistance and even more so on child benefits as their main source of income. And then for race, Alan and Anthony are Black. 22.8% of the Black Creek community are Black, which is the highest percentage of all visible minorities in this community. So for Alan and Anthony, there are some barriers to accessing care. Some of those are lack of health literacy, financial strain due to current income situation, and financial stress associated with possible use of therapies for Anthony if required. lack of social and family supports, and difficulty finding resources on their own. So now we're going to talk a bit about what is autism. Since Anthony is coming in for a visit to discuss concerns about an autism spectrum disorder, it's important to understand what autism spectrum disorder is. So autism spectrum disorder, ASD, is a complex developmental condition that involves persistent challenges in social interaction, speech, and nonverbal communication, and restricted or repetitive behaviors. The effects of ASD and the severity of symptoms are different in each person. There are approximately 135,000 diagnosed people with autism in Ontario alone. 1 to 2% of the Canadian population are on the autism spectrum. 1 in 66 Canadian children and youth ages 5 to 17 have autism. And so now we're going to look at assessment tools for Anthony. So when completing a nursing assessment, the nurse should observe for the following when looking for signs of autism spectrum disorder. So in terms of subjective data, we're looking for difficulty sleeping, irritability, rarely showing enjoyment of objects or activities. And for objective data, we're looking at failure to make eye contact, overly focused interest in specific topics, increased or decreased sensitivity to light, noise, touch, and temperature, and detailed memories. Okay, and then for other assessment tools, we would have Alan complete evaluation screening questionnaires, such as the ASQ3 or MCHAT, which is appropriate for Anthony's age. In this case, it would be the 60-month questionnaire for the ASQ3. And here you can see just a couple of pictures of what those look like. And then, so some nursing considerations for Anthony. Begin the assessment slowly with visual inspection and progress through assessment as the child begins cooperating. Fast movements can cause anxiety and fear. Avoid anxiety as much as possible. Note any repetitive behaviors. Obtain information and history from the patient's parents regarding triggers for anxiety and behaviors, eating habits, and sleeping patterns, and determine baseline and expectations of how patients will react to the healthcare teams and procedures. This helps to determine the course of action and treatments and best practice for assessment of the patient. Continuing for Anthony, sit down or position yourself near the patient's eye level. Being at eye level helps ease anxiety and build trust. Explain every procedure and demonstrate on self or parent. Talk with the patient about their interests. Evaluate communication abilities and develop rapport and trust. Provide a calm and inviting atmosphere. Limit number of people in the room to those whom the patient is most comfortable with. And provide resource information and education for parents. And then for Alan, some nursing considerations are to help Alan have less anxiety in caring for a child with ASD. Provide information on how to manage symptoms or behaviors, help Alan find therapists and counselors to help children with developmental disabilities, teach alternative methods for coping with behaviors, discuss resources and supports for Alan, and encourage her to book an appointment with her primary care provider to discuss her health and how to cope with various stressors. And now I'm going to hand it over to Tenzin.
Hi, so today I'm going to talk about the behavioral management and the communication developing strategies, starting with the first one is reinforcement. It can be provided for displaying positive behavior to encourage this behavior to continue or refraining from or reducing the negative behavior. Structure the learning environment and make a routine so that the student needs to communicate to access objects of interest and preferred activities. Incorporating preferred items into the student's classroom will help to establish an environment in which the student is motivated to communicate in the actual setting in which similar future communications are likely to occur. Provide verbal, physical, or visual prompts to help understand various situations, and it also helps to signal to encourage or enhance communications. Prompts can help students who don't know what to say during routine or in novel situations. Pause frequently during activities the student prefers. The student's motivation to participate or continue with a motivating activity will provide an incentive for the students to communicate. Augmentative and alternative communication methods. It makes use of services and devices such as visual symbols, signs, or voice output devices to supplement or replace a student's current method of communication. For example, pictures and word cards digitalized speech. And now I'll be talking on the development of social skills. Building a foundation of skill development. It is necessary to work on skill development by directly teaching the language rituals of social interaction, as child with ASD do not learn the social skills through the incidental experiences or exposure to social situations. Role of peers and peer awareness. Peers will play a significant role in helping a student learn how to interact successfully and can be supportive buddies during recess, lunch, library, during cooperative work periods for specific subjects. Arrange for buddies to work in pairs so that they can talk about and plan their activities. Teaching the fundamentals of social skills to facilitate positive interactions at school, for example, greetings, initiating and closing interactions, choosing activities, sharing, waiting, turn taking, and playing games. Now, methods to improve the social understanding. The first one is social scripts. It can play an important role in the development of social skills. It is used to clarify and provide model of the language and the social interaction. Stories that teach social understanding. This idea is to inform the reader simply, clearly, and in a reassuring manner how and why he should respond in a certain way. Such a story might explain how students can manage time and behavior at recess. Recognizing emotional and facial expression by asking questions with pictures, for example, like photographs of students, parents, siblings. Picture symbols, magazine pictures can be used to illustrate a range of emotion. For example, like what does happy, sad, angry, frightened, bored look like? Or what makes you happy, or what makes mommy happy, or what makes your teacher happy? And the use of media in developing social awareness. Popular television shows and movies can be used to teach and reinforce understanding of social situations and facial expressions. Pause the video at key points and then ask questions such as what's the name of the character, and what is the character, whether it's boy or a girl, or what he is wearing. So now Yuto will be continuing with her subtopic.
Hi, I'm going to talk about how to build a trusting relationship with your client. There are four main strategies. The first one is identifying barriers to trust. Consider if the child has past history of being mistreated. Some autistic children have faced severe bullying or abuse, including therapy abuse, that may lead them to untrust other people. Observe on child's communication skills. If the child can't express their needs, then it's less likely that their needs will be met. When adults don't help in meeting child's needs, the child struggles to trust them. Consider ways you may have misconducted in the past. If you have communicated with the child before and they don't seem to like you, it could be because you did something that was unpleasant or inconsiderate. Consider whether you could be frightening to the child. Adults can be scary and terrifying, especially if they are unpredictable or noisy. Make sure to stay calm and steady when you interact with them. Ask the child's family members and loved ones about their behavior. They may have insight regarding why the child is shy or introverted. They can also tell you what scares or upsets the child, so you can avoid doing these things. The second one is being trustworthy and predictable. Recognize that trust needs to be gained, especially if a child has been hurt before. You can't expect to be trusted if you don't make a habit of being trustworthy. Stay calm, steady, and predictable. Make sure to keep things pleasant and low-key. Shouting and mood swings can be scary to an autistic child. Be aware of the noise you make, especially if the child is hypersensitive. If you want to do something loud, warn the child first. Be honest and keep your word. Autistic children focus on the literal meaning of your words, and this might be the only thing they can use to judge your intentions. Clear out your emotions. Autistic children may have struggled reading tone of voice and body language, so they may have difficulty to figure out how you feel. It can be helpful to verbalize how you are feeling. For example, I'm not mad at you, just frustrated about the delay. I know it's not your fault. The third one is interact positively. Show them how much you love and care about them. You may have, you might know that you love and care about the child, but that doesn't mean that the child knows it. Show your love and affection for them in your words and actions. Presume competence. Act with the assumption that the child is a good person who wants to do their best and make other people proud of them. This helps the child feel supported and encourages them to rise to meet your expectations. Respect their boundaries. Autistic children also need personal space and may not happy to be hugged, kissed, holding hands, and other forms of touch. Instead of holding them and hugging them, ask if they want a hug. Respect the child's desire to be non-interactive sometimes. The child won't always like to spend time with you, especially if they are overwhelmed or stressed. If so, let them have quiet and peaceful time. They will notice if you respect their boundaries and will be more likely to trust you in the future. Engage their personal interests. Autistic people love to talk about and do things related to their special interests. By listening to an autistic child talking about their special interests and taking an interest in it, they start to see that you care about their interests and may trust you. Be kind when they mess up and make mistakes. Autistic children can be especially sensitive to criticism, so it's important to provide reassurance and clear direction instead of blaming and scolding. Make good memories together. Keep being positive, encouraging the child and doing fun things together. Remind the child of enjoyable things that happened. The last one is handling problems. Believe them if they say something is wrong. An autistic child might have a different perception of the world. If they say that something is distressing and upsetting, believe them. Be respectful about unusual speech. It's okay to ask for clarification or admit that you don't understand. Tell them that you care about what they are saying and are having a hard time understanding. Ask them to repeat it more slowly or write it down so that you can understand. Be patient and understanding. When communicating with each other, there might be a miscommunication and disagreement between the two of you. If you stay friendly and affectionate towards the child, they will be more likely to trust you in the difficult moments. Sit with them or disengage if you don't know what to do. If a child is having a crisis and you aren't sure how to respond, don't try to guess what to do. Ask someone who knows the child better if you don't know what to do. It's okay to seek help if you are uncertain. Apologize if you mess up. If you upset the child or mishandle a situation, say that you are sorry and you didn't mean it. This reassures the child that you still love and respect them. Next, Kyla will do the legislation.
Thank you. Okay, so now we're just going to talk about a bit of subsidies that are available for Anthony and Alan. So subsidies include the child care fee subsidies, which helps with the cost of child care for children under the age of 13. The Ontario Child Benefit, which helps parents with the cost of raising their children under the age of 18. There's the Women's Economic Security Program, which provides training and services for low-income women that helps them find employment, start their own business if they choose, and improve their economic security. And then there's the Ontario Child Care Tax Credit, which is a personal tax credit to help with childcare costs. And then for legislation, there is the World Autism Awareness Day Act, which is an act in Canada that recognizes World Autism Awareness Day on April 2nd of every year. And now I'm going to hand it over to Dana.
Thank you, Kyla. I would like to talk about resources or external partners that might be useful for Anthony and Alan. First, for Anthony, Ontario Autism Program supports children and youth by providing financial funds to their parents to purchase services they require, to participate in events, to pay for assessment interventions, and more. Through the OAP, Anthony and Alan can access programs and services such as core clinical services, for example, applied behavioral analysis, speech language pathology, occupational therapy, and mental health support based on the child's individual needs, as well as foundation family service, for instance, learn, explore, and play programs. Through the OAP, they also can connect with other government programs for children with special needs, such as special service at home, which provide services to relieve the child caregivers. Free caregiver mediated early years program, 18 months to 4-year-old, help young children to learn new skills, communicate, play, and more. Other resources for Anthony Shining Truth Center. Children exhibiting signs and symptoms of autism spectrum are assessed and diagnosed. Has various programs, therapies, and education services for children with autism. Example, applied behavioral analysis. That is a therapeutic program which is created based on the individual developmental needs, such as communication, social interaction, self-care skills, school preparation, and more. Black Creek Community Health Centers, which offers health promotions, programs, and services for children and parents. Autism Ontario Community Connect is a charitable organization across Ontario. Through this organization, the parents can find healthcare providers such as physicians, occupational therapists, speech language pathologists, physiotherapists, dentists, and social workers. Autism Ontario allows individuals like Anthony to access and participate in various education sessions and events such as Your Region, Meet a Beekeeper Honey Tasting, Aircraft in-Flight Virtual Tour, and Introduction to Autism and Autism Ontario for Caregivers. Other resources for Anthony, Holland, Bloorview Kids Rehabilitation Hospital. Children like Anthony are assessed here and then referred to community-based child development programs and services. Luminous Mental Health Developmental Community Services provides free support and services by the Better Beginning Now program, which includes the home visiting services and the parent toddler program. Mobile Developmental Outreach Clinic, health professionals here provide autism screening intervention, as well as multiple programs for children 18 months to 4 years old and their parents. Ontario Association for Infant and Child Development, a program which provides diverse services and support for infants and children from birth to 5 years of age with developmental delay. Other resources and partners such as Autism in Mind Children's Charity, Kid Mechanics, Playbase, Kids Connecting, ABA Academy, Positive Behavior Support Corps Canada, Surrey Place, Sick Kids Hospital. Resources or external partners that might be useful for Alan. Humber College Community Employment Services, which provides help for individuals who are looking for job opportunities. This service may be appropriate for Anne in finding a job, either full or part-time, to improve her financial resources. York UTD Community Engagement Center, it can help facilitate continuing education for Alan. Skill for Change, Alt Hayward Center for Women, Anita, or Northwood Neighborhood Services, helping Alan to improve her job skill necessary for employment or just improving her socialization with other people. Other resources or partners for Alan, Vaughan Food Bank and North York Harvest Food Bank if they need supplement for their food. Ontario Addiction Treatment Center is a partner with Black Creek Community Health Center that offers to women addiction counseling and management. Center for Interpersonal Relationships provides treatments for self-esteem, anxiety, and stress. And then the last, Black Creek Community Health Center, which provides primary care service, mental health, and counseling. And now I can take, I introduce again, Kyla. Thank you.
Okay, so just to wrap up for our care plan for Anthony and Alan, the goals and outcomes for this care plan include Alan and Anthony receiving a thorough nursing assessment and nursing intervention that address the family's concerns or needs. Anthony receives a comprehensive assessment by his nurse practitioner, which may include diagnosis or referral to obtain diagnosis. Both are connected with resources in the community as listed before. And then Alan and Anthony's health and wellness goals are met or are working towards being met. And these are our references for our presentation today. Thank you very much.
Thank you.